Did you know that phimosis, a condition where the foreskin can't be pulled back from the head of the penis, affects about 40% of men over the age of 45? And that circumcision, the surgical removal of the foreskin, can reduce the risk of HIV infection, syphilis, herpes, and human papillomavirus HPV in heterosexual men. These are some of the surprising facts that show how relevant and important phimosis and circumcision are for your health and well-being. Welcome to this video on phimosis and circumcision, dispelling myths and presenting facts. In this video, we will uncover the truth about these two topics that are often misunderstood and misinformed. We will explore the common myths and misconceptions surrounding phimosis and circumcision, and provide factual information and scientific evidence to debunk them. However, there are also many myths and misconceptions that surround phimosis and circumcision, which can lead to confusion, fear, and stigma. Some of these myths and misconceptions are: Myth number 1. Phimosis is always a problem that needs to be treated. Fact: phimosis is not always a problem that needs to be treated. Phimosis is normal in babies and young children, and usually goes away without treatment by about age 5. This is called physiologic phimosis. Phimosis only becomes a problem when it causes symptoms such as pain, difficulty urinating, or infections. This is called pathologic phimosis and is caused by something else, such as scar tissue, skin conditions, or infections. Myth number 2. Circumcision is always beneficial and harmless. Fact: circumcision is not always beneficial and harmless. Circumcision does have some health benefits, such as reducing the risk of certain infections and diseases, but it also has some risks and complications, such as bleeding, infection, pain, scarring, and loss of sensation. Circumcision is also a personal and cultural decision, and not everyone agrees on its necessity, morality, or ethics. Myth number 3. Phimosis can only be treated by circumcision. Fact: phimosis can be treated by other methods besides circumcision. Circumcision is often not required for treatment of phimosis. In some cases, phimosis can be treated with steroid creams, stretching exercises, or antifungal or antibiotics. In some rare cases, phimosis can be treated by a propudioplasty, which is a minor surgery that widens the opening of the foreskin without removing it. Myth number 4. Circumcision can only be done in infancy or childhood. Fact: circumcision can be done at any age, from infancy to adulthood. However, circumcision in adulthood may be more complicated, painful, and expensive than in infancy or childhood. Circumcision in adulthood may also require more time for recovery and healing, and may affect sexual function and satisfaction. 66. Myth number 5. Phimosis and circumcision are only related to physical health. Fact: phimosis and circumcision are also related to emotional, psychological, and social health. Phimosis and circumcision can affect your self-esteem, confidence, and body image. They can also affect your relationships, intimacy, and sexual satisfaction. Phimosis and circumcision can also have cultural, religious, and ethical implications, and may be influenced by social norms and expectations. As you can see, there are many myths and misconceptions that surround phimosis and circumcision, which can be harmful and misleading. It is important to seek factual information and scientific evidence to dispel these myths and misconceptions, and to make informed decisions regarding these issues. So, what are phimosis and circumcision, and what do you need to know about them? Phimosis is a condition where the foreskin can't be pulled back from the head of the penis. It only happens if you're uncircumcised. The foreskin is a piece of tissue that covers the head of the penis. Babies are born with a tight foreskin that's often removed in a procedure called a circumcision. If it's left in place, the foreskin gradually loosens as the child grows. Usually by about age 6, it can be pulled back completely to pee and to clean underneath it. Rarely, the foreskin can stay tight into the teenage years or adulthood. Phimosis can be divided into 2 types: physiologic and pathologic. Physiologic phimosis. Physiologic phimosis is natural and normal in young children and usually resolves as they age. Pathologic phimosis is abnormal and problematic in older children or adults, and is caused by some type of condition, such as scar tissue, skin conditions, or infections. Pathologic phimosis. Pathologic phimosis is a condition where the foreskin of the penis can't be pulled back from the head of the penis due to scarring, infection, or inflammation. It can cause symptoms such as pain, difficulty urinating, or infections. Symptoms of phimosis. Phimosis can cause a range of symptoms that can affect your physical and emotional well-being, such as low sex drive or libido, difficulty achieving or maintaining an erection, reduced sperm count or fertility, fatigue, weakness, or loss of energy, muscle loss or difficulty building muscle, increased body fat or weight gain, osteoporosis or bone loss, hot flashes or night sweats, depression, anxiety, or irritability, difficulty concentrating or remembering things, low self-esteem or confidence. Treatment of phimosis. Phimosis can be treated by various methods, depending on the type, severity, and cause of phimosis. The treatment options include: Number 1. Steroid creams or ointments. These can help reduce inflammation and swelling and make the foreskin more elastic and easier to retract. They are usually applied 2 or 3 times a day for several weeks and may be combined with gentle stretching exercises. Number 2. Stretching exercises. These can help loosen the foreskin and increase its opening. They are usually done by gently pulling the foreskin back and forth or by using a device that stretches the foreskin. They are usually done for several minutes a day for several weeks or months and may be combined with steroid creams or ointments. Number 3. Antifungal or antibiotics. These can help treat any infection that may be causing or contributing to phimosis. They are usually taken orally or applied topically, depending on the type and severity of the infection. Number 4. Prepudioplasty. This is a minor surgery that widens the opening of the foreskin without removing it. It involves making 1 or more small cuts in the foreskin and stitching them back together. It is usually done under local anesthesia and takes about 30 minutes. It has a low risk of complications and preserves the function and appearance of the foreskin. Circumcision. This is a surgery that removes the foreskin completely. It is usually done under general anesthesia and takes about an hour. It can be done at any age, from infancy to adulthood, but it is more common and easier in infancy or childhood. It has a higher risk of complications such as bleeding, infection, pain, scarring, and loss of sensation. It also changes the function and appearance of the penis. The choice of treatment for phimosis depends on your personal preference, medical condition, and cultural or religious beliefs. You should discuss the pros and cons of each option with your doctor and make an informed decision that suits your needs and goals. Circumcision has some health benefits, such as reducing the risk of certain infections and diseases, but it also has some risks and complications, such as bleeding, infection, pain, scarring, and loss of sensation. Circumcision is also a personal and cultural decision, and not everyone agrees on its necessity, morality, or ethics. Some of the health benefits of circumcision include reduced risk of urinary tract infections (UTIs), especially in infants and young children. Reduced risk of phimosis and paraphimosis and their associated problems. Reduced risk of balanitis and balanopostitis, which are infections and inflammations of the head of the penis and the foreskin. Reduced risk of penile cancer, which is rare but more common in uncircumcised men. Reduced risk of cervical cancer in female partners due to protection against certain strains of human papillomavirus (HPV. Reduced risk of sexually transmitted infections (STIs), such as HIV, syphilis, herpes, and HPV, especially in heterosexual men. Improved hygiene and cleanliness, as it is easier to wash the penis without the foreskin. As you can see, phimosis and circumcision are 2 topics that are often misunderstood and misinformed. It is important to seek factual information and scientific evidence to dispel the myths and misconceptions that surround them, and to make informed decisions regarding them. Thank you for joining us in this insightful exploration of phimosis and circumcision. We've delved into some surprising facts and dispelled common myths surrounding these topics, shedding light on their relevance and importance for health and well-being. If you found this information valuable, don't forget to like and subscribe to our channel for more informative content. We're always eager to hear from our viewers, so feel free to leave your comments and suggestions for future topics you'd like us to cover.